Today we have Dr. Shada, who is a board-certified anesthesiologist and a pain management specialist, to talk about treatment-resistant RSD. Welcome, Dr. Shada. Thank you for joining us, and thank you for your time. Would you kindly tell us about RSD?
RSD, reflex sympathetic dystrophy, sometimes also called complex regional pain syndrome, is a terrible disorder of the nervous system. And there are no FDA-approved medications for this, and that's why we've developed Ketafresh. Ketafresh is a type of ketamine treatment that specifically blocks complex regional pain syndrome, RSD pain.
Ketamine, which is not as invasive as using a nerve stimulator, it has been very beneficial. Would you kindly elaborate on the advantages of using ketamine for the treatment?
Ketamine is an old drug. It's been around probably 40 years, and you and I have used it in anesthesia for many years. But most recently in Europe in the last few years, they've been doing many studies, and in the United States, using it on an outpatient basis over usually a 3-day period to break the cycle of complex regional pain syndrome. Some patients even go into remission after this treatment.
Fantastic. Would you tell us how it is done?
The patient has to be evaluated by a pain specialist such as you or I, and if there's not any medical problems that would prevent them from having this treatment, it's done on an outpatient basis. In other words, they come to the surgery center and are admitted, and we start an IV. They have very careful monitoring, continuous monitoring, because it is an anesthetic, and they're there usually for 3 or 4 hours.
And as we know, the ketamine has other side effects such as hallucinations. Is there any way to prevent those hallucinations?
Very good question, Dr. Kikkeri. As you know, in anesthesia, we often pre-medicate, and so that's exactly what we do here. We have a special medicine that we use as part of our Ketafresh treatment that allows us to minimize those side effects. Plus, close monitoring by our highly trained staff, they're able to titrate the dose so that you don't have these side effects.
This has been a very useful talk. Thank you very much, Dr. Shada.
You're welcome. Pleasure to be here.